I call Jen Logie.
Mr. Chair. I rise to take a short call on behalf of the Greens. It's committee stage of the Health Practitioners Replacement of Statutory References to Medical Practitioners Bill. And I would like to, this is my first time speaking in the House since the valedictory of my colleague Kevin Haig, who was our health spokesperson. So I would like to start my contribution by acknowledging him. He has followed this bill through Parliament up to this point, and he was a huge asset to this Parliament, and somebody I think that generally was well respected from his knowledge of health in a community setting, as well as the chair of the West Coast DHB, and he has assisted many pieces of legislation in grounding into reality, and he will be well missed, including by me. So we are supporting this bill. There are several reasons for it. One, and some of them have been traversed already, I guess, is about that there are, as we have an ageing population, the demands on our health system and financial demands are growing. And as the technological supports around health actually also become more advanced, we have another health cost pressure on our health system. So we need, as a country, to be innovative, and part of innovation is looking at where we can save money and be more efficient. And at the moment, it's pretty clear to most people, and I think was the rationale behind this bill in part, that there are inefficiencies in our systems as we have doctors spending a lot of their time doing paperwork and signing off things at a very high pay rate that could be done by somebody on a lower pay rate who has the skill. And I think that is probably a driver for this bill, and it is a driver that we support. We want our health dollar to be used as effectively as it can possibly be used. I've worked in a youth health organisation, and I know that that's a very important area of health, and it's one of those system-wide things that now we have student loans. It's actually quite difficult to get young doctors working in those services in the communities because they're needing to look for the higher paid jobs to be able to pay off their loans. So nurses traditionally play quite a significant role in our community-based services, and being able to give them additional functions, as this bill does, actually serves the delivery of those services and many of our diverse communities in making sure that they get accessible and affordable health care. And so we absolutely support that. And I remember that Kevin Haig noted that in a rural setting where we have nurse specialists, many of those nurse specialists are already fulfilling a lot of functions, and again, this piece of legislation aids that work and aids our rural communities. So the Green Party is very happy to support this piece of legislation. It is sensible, promotes efficiency of a precious resource where we would like to see more money going in, being able to be used for more significant health outcomes. Thank you.
Ginny Salisa.
Thank you,